We need to know about the condition of cerebral palsy, fascinating condition that comes in different varieties and different degrees of involvement. Typically, cerebral palsy is a complication with reflexes. And the 5 different varieties of cerebral palsy are spasticity. Most people associate cerebral palsy with spasticity, where again reflexes dominate and the flexor muscles predominate and have a tendency to have contractures in them because they get shortened. Ataxia is a poor sense of balance, causing the person to be unstable on their feet. Athetoid cerebral palsy is a writhing kind of motion, as opposed to spasticity, which is jerking motions. And then certainly rigidity takes effort to overcome the tightness of the muscles. And then tremor, interfering with function. Provided a glossary of terms for you, and spasticity, athetosis, and chorioathetosis, which would be a combination of the two. Ataxia we've come across previously in our studies, haven't sat down on it really, and that is impaired ability to coordinate movement. Dysmetria is an inability of the person to measure distances, and so if my nose on the screen, if I went to touch my nose on the screen, it's tougher than I thought, and then come back to my nose, it's tough to gauge the distance. So when they start a movement, people who have dysmetria start a movement, they begin to go, but there's a poor communication with the cerebellum, which should smooth out movement and make mid-course corrections efficiently. That efficiency is lost, so invariably they start to move back toward their target, and they're off target, and they have to make a radical correction to get to where they're going. And then dyskinesia is an impairment of the ability to execute voluntary movements. So the severity and locus of cerebral palsy are dictated by their ability to maintain balance and posture, to speak and hear, their mental capacity, and seizures. So determining the type of cerebral palsy, which would have to do with locus, and the severity of involvement have to do with their capacity to do those things. Cerebral palsy is not inherited, and it's not progressive. Okay, so there's much that's not known about why it occurs. Etiologies can be traced to infarctions in the infant, in the fetus, in the infant, or in the neonate. Cerebral vascular accidents can cause it. Hypoxia, not enough oxygen to the brain, or secondary hemorrhage in the brain. Onset, like I indicated, can happen prior to the birth, during the birth, or manifest up to months after postnatal. Okay, their fitness deficits, they have a tendency to lack extensibility. They tend toward flexion. Their flexor muscle groups predominate. They tend not to have much strength or endurance. As I indicated to you, there's a predomination of flexor muscle strength, and the myotatic stretch reflex is a hyper reflex. Once the stretch starts, there's an overshoot to the movement, and that's specifically found in the expression of spasticity. How do we help our clients with cerebral palsy? Slow, sustained stretching. Quiet the reflexes, so no ballistic activity. That's contraindicated. Slow movement. Avoid ballistic movement. Promote independence through increasing efficiency of activities of daily living. The use of Botox to reduce the volume of muscles that are driving unwanted activity or leading to spasticity. And then there's some indication, not really, it's very controversial about whether hyperbaric treatment reduces symptoms, and at this point the jury's out on that. In order to quiet reflexes that are tend to be excessive, we need to promote having our client, our friend, maintain a neutral head position. Avoid extremes of flexion or extension, because once they get there, if they fall back into this position, then it activates a stretch reflex, and that's a problem. So working with the person, giving feedback of keeping the head in neutral position is way good. And then we're going to practice in lab these positions. I want you to be, honestly, this is the takeaway. You meet a child at the park with cerebral palsy, you want to be good for that kid from the very first greeting. Or you're the physical therapist for that person, and you need to right off the bat set them at ease. And I'm going to do this in a positive way, and then I'll do a negative way. And that is, in order to quiet the reflexes, position yourself in front of the client prior to the interaction. So you get face on them, you get down to eye level, and you relate to them right here. Be right here, yes? If you're above them or you approach from the side, very often they'll do an on-guard reflexive behavior. They don't mean it in a mean way. It's just that that's a defensive reaction. It's a reflexive reaction. I don't know if I want to say it's defensive, but if you'll get right down at them and be face on them, then they'll not have that over-reflexive response. Okay? So, face on, eye level. The people with cerebral palsy have a tendency to really have flexion contractures. They have a tendency to have, if there's involvement of the lower extremity, they tend to have really short gastroc and Achilles tendon contractures. They tend to, over time, be hyperplantar flex. They have to walk on their toes. They have to have tendon release surgery. So gait training is way important to minimize that, or even progressive, called serial casting, to elongate the Achilles tendon. And then this is way good at the affective level. Allow your clients to express themselves. May take them a bit of a time to get said what they want to get said, but don't fill in the words. Don't be in a hurry. Care enough about them to be patient as you listen. And then certainly there are some CP clients who will never speak, and we want to promote their communication and be alert to what they have to do. They may have very keen intelligence, be very perceptive, be graduate level scholars. They just can't talk, and they maybe can't move effectively, and they can't feed themselves. But there's means to communicate electronically that that is just so awesome, that they can move toward a full life in spite of their physical and verbal limitations. So, okay, Lord bless you. Be a student of cerebral palsy.